There's an element of detective story work in epidemiology. It is going back to the scene of an event and trying to understand what happened there. And we thought that to try and pick a very particular example of how that work is done might give a vivid illustration of the sophistication of the work and a mysterious and kind of intriguing experience for someone experiencing the work we're making.
Earlier this year we had a residency at WHO in Geneva and we made 3 trips there, and in that time we attended the daily meetings in the shock room, which is where they do all of their daily briefings about signals for contagious disease around the globe.
The shock room is the Strategic Health Operations Centre, and every day at 9 o'clock for half an hour the senior members of the team meet to go through a very tight agenda of what is considered in that day the most important to deal with and to tackle at a senior level.
We were amazed by the volume of signals that the WHO are checking for. 500,000 signals a month come into the WHO for assessment. The process of sorting through all of those different pieces of information and trying to extract from that what is meaningful, where the risks lie, where contagious diseases are starting to spring from in their earliest stages was incredible. They're operating in an environment where they must act quickly, and yet they always have incomplete information, but waiting is not an option. We had access that many people would dream of having. We were also really conscious of trying to make good use of that privileged position to try and really bring something out of that residency that would have a wider interest.
We had conversations with at least a dozen members of staff, from heads of department for ageing and flu through to people who have historically been involved in the Ebola outbreak and in SARS.
When we were researching at the World Health Organization in Geneva, we came across an amazing diagram that showed one floor of a hotel and who was staying in each room on that floor. As we looked into it further, we realized that it's the night of the 21st of February 2003. SARS was spreading for the first time from the Chinese mainland into Hong Kong, and then from there out across the world. What happened was a doctor who had been treating patients with SARS traveled to visit his family in Hong Kong. He checked into the 9th floor of the Metropole Hotel, unaware that he himself had contracted SARS. He was ill that night, and by the time he realized what had happened the following morning, a number of people on the same floor were infected. And the next day, those people then flew on to countries like Canada, Singapore, and Vietnam, taking the illness with them.
We often hear about contagious disease in the context of remote parts of the world, say in Africa with Ebola, whereas in the instance of SARS in 2003 in the Metropole Hotel in Hong Kong, it could easily be any one of us who has that lifestyle where you check into boring hotels, you go on business trips. That seems like a very familiar thing and a familiar way to introduce people to the idea of contagious disease.
This hotel room is an example of what level of work needs to be done to understand how diseases spread and to respond in real time. The level of detail went as far as to do testing of the direction of the air in the corridors of that hotel. Smoke tests were done to determine which way the air was traveling and how that might have then affected who contracted the disease.
Millimeter is a company we've been working with for the last few years. For this project, they're specifically looking at developing a smoke system that allows us to simulate some of the epidemiological work that was done at Metropole Hotel and fabricating a model out of milled aluminium.
We were fascinated by smoke as a metaphor for ignorance and uncertainty. And so that's what has led us to look at making a model that will simulate the smoke tests that were done. So the visitors who come to see the work will experience an exact scale model of the hotel. People have different ideas about what an artwork might do in terms of transmission of information. Our job is to try and bring a fresh insight into the work of the WHO, not to proselytize for the organization. We're trying to ask questions of the work that they do.